Hello, I'm Dr. Kurtis Woolf, family practice physician, and today I'd like to talk to you about cholesterol. I thought I'd finish up the big three, the three most common chronic medical problems I see are high blood pressure, diabetes, and high cholesterol, and they tend to go together. It's rare for me to see someone who has diabetes who does not also have high blood pressure and high cholesterol. And the three together make up what we call metabolic syndrome. People with metabolic syndrome are at increased risk for heart disease, heart attacks. If I could magically cure or at least control these three conditions, people would live longer. The recommendations for treating high cholesterol have changed a bit recently. In some ways they're simpler, in some ways they're a bit more complicated. And some of you may have been put on cholesterol medication by the previous recommendations, and some of you may have not been put on a cholesterol medication that should be on a cholesterol medication. And if you have questions about that when we're done with this, be sure to give us a call or make an appointment. So we treat cholesterol all the time, but a lot of people don't actually know what cholesterol is. Cholesterol is actually a natural substance. Your body makes it, mostly in the liver. It's a building block that is in the walls of your cells, so it's in almost every cell of your body. It's also needed to synthesize some hormones in your body that we need. So there's nothing inherently bad with cholesterol, and we do need some cholesterol, but it's very rare for me to see somebody who doesn't have enough cholesterol. As a matter of fact, I don't think I've ever seen anybody who didn't have enough cholesterol that they needed. 75% of the cholesterol that you have in your body is made by your liver. The other 25% comes from your diet. So why is high cholesterol bad? To keep it simple, cholesterol causes plumbing problems. Too much of the wrong type of cholesterol builds up in the walls of the vessels of your body, particularly the heart, the vessels feeding the muscle of your heart, and causes hardening of the arteries, what we call atherosclerosis. So why is this bad? This cholesterol gook decreases the blood supply, particularly to your heart, and if you don't get enough blood supply to your heart, you'll get chest pain, what we call angina. If one of those vessels is completely blocked, it causes a heart attack. Part of the muscle of the heart actually dies and is permanently damaged. If you get this cholesterol gook in the vessels of your neck or in your brain, and the piece of that breaks off and goes to the brain, then that can cause a stroke. So that's what we're doing when we're treating high cholesterol, is trying to prevent those problems. Now, not all cholesterol is the same. You've probably heard people talk about the good cholesterol and bad cholesterol. When I check your cholesterol, when we get what we call a fasting lipid profile, and I look at it the next day, there's four main things that I look at. The first is the LDL cholesterol. That's the low density lipoproteins. And that is what people call the bad cholesterol. This is fluffy cholesterol, sticky cholesterol. This is the stuff that is going to stick to the vessel wall and cause damage to them. The second thing I look at is the HDL, or the high density lipoprotein, and that is the good cholesterol. This actually kind of has a protective effect on the vessels of your body. It actually kind of goes through like a vacuum cleaner and helps clean up that bad cholesterol. And so you actually want that HDL as high as you can get it. The third thing I look at is the triglycerides. The triglycerides is fat in your bloodstream. And very high triglycerides does increase your risk for heart attack, and very high increases the risk for pancreatitis. When it's just a little high, we don't worry about it as much as the cholesterol. The last thing, I will look at the total cholesterol, and that is just one number that people like to talk about, what their total cholesterol is. It's kind of simple, but actually I'm more concerned about the ratio of the good cholesterol, the HDL, to the LDL. Because if your total cholesterol is really high, but that's because the HDL is really high, that's not necessarily a bad thing. And even if your cholesterol isn't that high, but the HDL is really low and the LDL is pretty high, that's still not good. Now, the treatment for high cholesterol. This is where things have kind of changed in recent years. For years, at least in the United States, we kind of treated the cholesterol number more than anything else. If the LDL, the bad cholesterol, was high, we wanted to get it down, and the lower the better, which made sense since we thought that the LDL itself was what was killing people. It turns out that the actual numbers on the cholesterol are less important than just making sure people who are at risk for having a heart attack are on these cholesterol medications that will help prevent that. So now, instead of just saying people who have high LDL cholesterol, we should get it down with medication, we have determined 4 groups of people who should absolutely be on a statin if they can tolerate it. And you might want to write these down, because if you're in one of these groups, you should be on a statin medication. The first group are people with atherosclerotic cardiovascular disease. These are people who've had a heart attack or angina, who've had stents in their heart, or had bypass surgery. They should, almost all of them, be on a statin medication. The second one is people whose LDL cholesterol is above 190, and that's pretty high. The next group are people who are aged 40 to 75 with diabetes. Even if your cholesterol isn't really high, if you're in that age range, you should probably be on a statin medication. The last group are people whose 10-year risk for atherosclerotic cardiovascular disease is calculated and estimated to be at above 7.5%. So when I get your cholesterol numbers, when I do a screening cholesterol on you, one of the first things I do is I just pull out of my pocket an app on my phone and I plug in your numbers. I put in your age, if you're a male, if you're Caucasian or African American, if you smoke, what your blood pressure is, if you have diabetes, and a few other things, and then that spits out a number to me. And if it's above 7.5%, you should be on a statin medication for cholesterol. Other people who should also, that aren't in these 4 groups, that should also probably be on a statin cholesterol lowering medication are, if you have a strong family history of heart disease, then we have to take that into consideration. It is not put into the calculations for your risk, 10-year risk of heart disease. But if your father, your grandfather, all your uncles have all had heart attacks before they were 60, and your LDL cholesterol is barely high at 101, if that was me, I would be asking my doctor to put me on Lipitor or something like that. Also, people who have had a stroke will benefit from statin medications. And also people who have chronic kidney disease. Something that a lot of people don't know is that the number one reason people with chronic kidney disease die is from heart attacks. So just having kidney disease puts you at increased risk for heart attack, so they also will benefit from statins. You heard me talk about statin medications. Statins are the class of medication that is our first choice for treating cholesterol. Some of these names you've heard of: Lipitor, also called atorvastatin; Zocor, also called simvastatin; Crestor. Those are the 3 strongest of these statin medications and the ones that we use most. We use this class first choice because they have the best outcome data at preventing heart attacks, which is the main reason we're treating cholesterol in the first place. Some potential side effects from these statins. Muscle aches is the most common side effect and the main reason that I have people stop the medication. Diarrhea, constipation, nausea, just GI upset in general is also pretty common. It actually does increase your risk of developing diabetes. So although high cholesterol kind of goes with diabetes, these medications can make it more likely for you to develop diabetes. That's a small risk and usually worth the risk. Some of the dangerous side effects from these medications are, one is called rhabdomyolysis. That is where these medications cause your muscle cells to break down, releasing something called creatinine kinase in the bloodstream that damages the kidneys. They can also damage the liver. And so when you come in about every 6 months and I check your cholesterol, I also am checking your liver function to make sure these medications aren't damaging your liver. And I usually check a creatinine kinase to make sure that you're not developing rhabdomyolysis. Other cholesterol medications, a couple that we used to recommend quite a bit, but don't anymore, one is niacin. Niacin actually makes that HDL go higher, and so on paper it actually makes us feel better. You know, your good cholesterol is going higher, your LDL actually drops a little bit better. You would think that that would prevent heart attack and stroke. Studies show that it really didn't. And it actually, when taken along with the statin medications, actually increased your risk for rhabdomyolysis. Another thing that we used to think was going to be helping people saving their lives is fish oil. I used to recommend fish oil all the time. It brought down the triglycerides, lowered the cholesterol a bit. Turns out, doesn't make a huge amount of difference to prevent heart attacks. And so, you certainly can take them if you want, but they really aren't going to give you the outcome that we thought they would. A couple other medications, when people can't take the statins, and I do have a good handful of patients that can't take statin medications, mostly because of muscle aches, or I've had a couple patients that actually did get the rhabdomyolysis or liver problems from them. The other medications that we have just really aren't as good, but they're probably better than nothing. A medication called Zetia lowers the risk of heart attack a little bit, about 2%, not nearly as much as the statin medications. Medications like Welchol or cholestyramine also lower the cholesterol and probably do protect the heart somewhat. They have more GI side effects and are not as well tolerated as the statins. Fenofibrate or Tricor, it's mostly used to lower the triglycerides, and if your triglycerides are really high, we will usually put you on fenofibrate first to get that down to a more reasonable level before we started a statin medication. And then if you are on fenofibrate and a statin medication, then we do really have to watch for side effects, particularly that rhabdomyolysis more, because being on both of them increases the risk of that. Lifestyle modifications are also important for your cholesterol, and all the things that we recommend for lowering your cholesterol are all things that we should all be doing anyway to lower our risk for heart disease. Diet, a healthy diet, the Mediterranean diet, I'll put a link to that here, I hope. That has been shown to lower cholesterol and to decrease the risk for heart attack. But also, low carbohydrate diets actually have been shown to increase the HDL, which we would think would help protect the heart, even though that might not be such a low cholesterol diet. Weight loss will particularly lower the triglycerides, but it also lowers the cholesterol and increases the HDL. And vigorous exercise increases the HDL. But all of those things, even if they aren't making a huge effect on those cholesterol numbers, are also just lowering your risk for heart attack, which is why we're treating your cholesterol in the first place. I hope this helps explain why I freak out about your cholesterol sometimes and try to put you on medications for your cholesterol even when you're feeling fine. Like with high blood pressure, high cholesterol by itself won't usually cause any symptoms. You'll be feeling fine with a high cholesterol until you have that heart attack or stroke. And then the medications that we put you on for high cholesterol will sometimes cause some side effects, muscle aches, stomach aches. So the reason we're giving you these medications are to help prevent problems. And we do it because we love you and we selfishly want you around us as long as we can. So even if these medications are causing mild side effects, if you get a little muscle aches, a little upset stomach, if you can tolerate that, probably in the long run you'll be better off. And then if you can't tolerate these statins, if they are absolutely causing intolerable side effects, make an appointment. There are some options that we can discuss. And then just like to reiterate, all of us, including myself, we should all be exercising more, eating a healthier diet, and trying to lose weight. And so I thank you again for watching. I hope this helps. I hope to see you again sometime soon.